Hello and welcome to For Kids' Sake, a show all about children and their health and well-being. I'm Rosalinda Roman, and I am thrilled to be on this show because it is all about health issues for kids, and we have expert Dr. Lance Chilton here. He's a pediatrician, and he is a professor of pediatrics at UNM. He also is a pediatrician at the Young Children's Health Center, excuse me. Welcome.
Thank you, Rosalinda.
It's so nice to be here with you. Thank you. And this show is kind of a really great resource for people who have kids of really any age, because we're going to explore a lot of the issues that are top of mind for all of us.
I hope it will be useful to our watchers.
Yeah, so let's talk a little bit before we get started. I think people need to know a little bit about you. I know you're not inclined to talk about yourself, but you have an extensive resume and do a lot of wonderful things for not just this community, but you've worked in communities all over the world. But here in Albuquerque, you've been working here for how many years?
About 40 years.
Yeah. So you've seen the wide range of health issues here, probably.
From colds to leukemia, to be sure.
Yeah, yeah. So tell us a little bit. Now, people here in New Mexico might recognize you you do a biweekly article for the Albuquerque Journal. Can you tell me a little bit about that?
Right. I try to pick a topic of interest to parents every 2 weeks and write about it. Often using questions that are posed to me by patients or by people who write in to me.
What kinds of things do they ask you?
Oh, all kinds of things, from information about autism to information about particular diseases, or to what might help their child to do better in school.
And that brings me up to a point that we talked about off camera before the show started, and that is that we're not just talking about sick kids or health problems. We're talking about child wellness and well-being. And that's really an interesting concept, because I think a lot of times we as parents think, okay, my kid is healthy, and only when they're not healthy do we think about medicine necessarily. But you were telling me kind of an interesting quote that I thought we should repeat for the viewers.
Well, I think that pediatricians in general try to look to the future of their patients, their future health as well. And the quote that I was mentioning to you is that you can't educate a child who's sick, and you can't make an uneducated child healthy.
Right, and that, because really if a child is sick, they have a harder time learning, they have a harder time engaging in sports, the community at large. So it's kind of the whole child that we're looking at, not just if they're sick, if they're healthy.
Right, and likewise, if a child is uneducated, they can't comply well with our suggestions as to how to make them well.
That's right. That's right. Well, this is just one of the many things we're going to be talking about on this show, and that's why I love the fact that I get to be involved in it, because I have 3 kids of my own, and I'm an aunt to about a dozen others. So I have a lot of questions, and my mommy friends are going to love the fact that we can ask you directly, because that's the trick with medicine nowadays. There's so much information, and sometimes it's hard to know who to turn to.
Well, I hope this will be one place they can turn to.
I hope so too. And today we're going to actually begin with your area of expertise, which is immunizations. And coming up after the break, we're not only going to talk to you, but we're also going to talk to Dr. Walter DeHorty. He's the assistant professor of pediatric infectious diseases at UNM. So we'll have hopefully a good conversation.
Good. I'm looking forward to it.
Okay. But before we get to that, I want to talk a little bit more, because one of the things I don't want to jump too fast into is, this show is going to be with you every week. Every time we have the show, I want people to know a little bit more about you. And you are a longtime advocate for children. And particularly, you've worked in some impoverished communities.
Right. I came to New Mexico to be in the Indian Health Service 40 years ago. And I've continued to work with impoverished communities here in Albuquerque since coming to this town.
Awesome. Okay, so you obviously have the expertise. We're going to check in with you and Dr. DeHorty coming up after the break, and we hope you will stick around because we have a lot more information to share with you, so don't go away. and welcome back to For Kids' Sake, the show with Dr. Lance Chilton to answer all your questions about medicine and children. It is not just about medicine, but also about their well-being. So this is an important thing to mention because today's topic is immunizations, and it is a hot topic. So we have two experts here. We start with, of course, Dr. Lance Chilton. He is our resident expert, and this is your area of expertise.
It's one I like to talk about a lot.
Yeah, well, you certainly have tons of experience in this field, but we are also joined by Dr. Walter DeHorty. You're Assistant Professor of Pediatric Infectious Diseases at UNM. Yes. So welcome.
Thank you.
So I have to say, this topic, all my mommy friends were like, oh, you have to ask about this and you have to ask about that, because the fact is, everybody that has kids or grandkids knows something, or at least thinks they know something, or has an opinion about immunizations.
I think a lot of people think that immunizations might have problems with safety. And indeed, there are side effects of immunizations occasionally. But I've always told patients that they took more risk driving to my office than getting the immunization.
Well, and that makes total sense, but it is kind of a hot topic. You know, there's celebrities who talk about it. Jenny McCarthy, I guess, was opposed to it, and she's a big name person on TV. And so when that happens, I think I see my Facebook feed light up and people post things and wonder, should I get my kids immunized? Shouldn't I? And I'm not sure it's necessarily easy to boil down to, is it safe or isn't it? How does a parent find that information?
Well, I think your pediatrician is a good place to start. And there are some reputable websites. You have to be careful where you're looking on the internet because there is a lot of misinformation out there. And you can find pretty much anything you want to find on the internet. And unfortunately, some of the individuals you mentioned, like Jenny McCarthy, have a built-in audience and can get camera time for whatever they want. So I would recommend starting with your pediatrician. The American Academy of Pediatrics is a website that has good, solid, reputable information on immunizations, as does the Centers for Disease Control and Prevention. So if you stay with reputable sources and if you have questions, ask. And again, your pediatrician is a great place to start.
And we can even start here. Let's start the conversation a little bit. We have a little bit of time to talk about what you guys do know that you can share with us about immunizations. And I think, number one, how important is it to get an immunization or immunizations for your kids?
The CDC recently put out a paper where it estimated the savings from vaccines. So if you take 1 year's worth of US kids, it saves 29,000 lives. Immunization does.
And that's in the U.S.?
That's in the U.S. alone. It saves $20 billion for that same group of kids in direct costs for disease, and $76 billion for that same group of children in direct and indirect costs, like taking time off work or having to do something for special education for your child who's been damaged by a vaccine-preventable disease.
Well, and I have many friends who do not immunize their children, and it seems to be that the question that comes up is it safe to put immunizations, get the vaccine into your body? It seems unnatural. Is there a natural alternative? And I never know the answer to that. I guess very few of us do, so I'm so lucky to have you guys here to ask that too.
Yes, immunizations are very safe, and if you think about all the medical interventions that we do, they're one of the most studied interventions. And they're continually monitored as well by the Centers for Disease Control and Prevention. So for example, we give approximately 100 million, 150 million influenza immunizations every year, 15 to 20 million pertussis immunizations every year. We have literally billions of immunizations that have been administered, and they have an incredibly safe track record. As Dr. Chilton was saying, you are probably more likely to have a severe problem in a car accident driving to your doctor's office than you will from a vaccine. So these are very well studied. They're continually monitored every single year by multiple sources for any new problems that may occur. So I think you can feel that the immunizations your child is receiving are very safe and tested medical interventions.
Okay, so I may have gotten ahead of myself. Maybe the best first place to start is, what exactly is immunization? Like, how does that work? It just seems so strange that you put something in your body to make your body healthy. Mm-hmm. How does that? What
you're trying to do is to trick your body into thinking that you've been infected with a particular germ. And the body then makes what are called antibodies, chemicals that fight the infection that isn't there.
Interesting. So can you get sick from the immunization, from the vaccine?
A lot of people think, particularly with regard to flu vaccine, that they got sick from the flu vaccine. The answer to that question is no, you can't. You can get a fever. You can get a sore arm. You can, in very rare instances, get a more severe reaction.
And why is that? Why would you have maybe a fever, or what is that? That's your body basically trying to fight it?
Yeah, a lot of things can give you a fever. So you can take particular medicines give you a fever. There are components to the pathogen or the bug that are being injected that could, because of the immune response, lead to a brief fever. But I think the main take-home point is that that's not a real dangerous response if you get that. The other issue that can sometimes come up with the flu vaccine, and I get the flu afterwards, is that we tend to give the flu vaccine during the cold and flu season. And so what normally happens is that somebody gets the flu vaccine, it's the middle of December, for example, and they catch a viral infection after that, and they get a runny nose and a cough. It's not the flu vaccine that did it, it was a viral infection they happened to catch, and that's really just a cost of living in the wintertime, really.
Yeah, and being inside with people and spreading germs among each other, yeah. So one of the questions I was asked to talk about is when your child goes in for their yearly immunizations, a lot of times they get a whole bunch all at once. Is that a good idea? Some people worry that it's too much for their bodies to handle. What do you think about that?
It's not too much, and it's actually quite safe. There's no evidence that you can, quote unquote, overload an immune system by giving the recommended vaccines per the schedule. And that's a common misconception, that if my child's going to get 3 or 4 shots and there's going to be 5 or 6 different bugs that they're being protected against, their immune system can't handle that, and that's just simply not true. There's no evidence to suggest that. And not only that, but there is a danger in not following that approach. So those immunization guidelines that are recommended were very carefully constructed with much thought by many experts over the years and are revised as new vaccines become available. And so when you stray from that, you're really entering uncharted territory. There was a physician by the name of Bob Sears who has published a book advocating spacing out the vaccine schedule a little bit, and there are variations on that theme, and that is actually dangerous, and there's several reasons for that. I think the primary one that I'd like to speak about is that you're really leaving your child unprotected for periods of time. So for example, if your child is due to get a meningitis vaccine at the age of 2 months, and there's a decision to delay it because you don't want to overload the immune system until 6 months, that child does not have that vaccine in their system for several months. So that would be analogous to deciding you wanted to drive your car without insurance every other month of the year and just hoping that you wouldn't get in a car accident during that time.
Or not wear a seatbelt.
Or not wear a seatbelt, right. And so I wouldn't want to do that with my car, and I certainly wouldn't want to do that with my child.
Well, and I was wondering about that because that's basically boosters. That's what you're talking about. You go in and you get a vaccine booster, right? Am I incorrect on that?
Well, the Sears technique, which is to space out, give one vaccine, give another vaccine, give another vaccine, has to do with the initial series also.
Oh, okay.
So, as Walter was saying, that if your child is unprotected against meningitis until 6 months of age instead of 2 months of age and gets meningitis in that interval, they haven't even gotten to the point of getting the booster shot that they'll get at 1.5 years of age.
Got it. Well, it looks like we're going to run out of time here. So are there any last points that you really want to impart to the viewers about immunizations?
Well, I think you wanted to talk a little bit about influenza. People talk about it's just the flu. Just the flu has killed 95 kids this year in the United States already. But I'm sure you can say a lot more about it.
Yeah, the influenza is not just the flu, and I think what the flu gets mislabeled. So somebody may have a runny nose and a mild cough, and they say, I have the flu. Influenza itself can be a very serious illness, and at the Children's Hospital, we see a lot of children that are infected with influenza that wind up in the intensive care unit, placed on breathing machines and life support, and as Dr. Chilton was mentioning, unfortunately can die. There are also side effects. You can get bacterial pneumonias following an influenza infection, which can be quite severe and can lead to death. And so it's not a very benign illness, and particularly in the elderly. This is not just a pediatric immunization. It's very important for all individuals to get this, and it can be a serious disease in the elderly population as well. where it can be a very high source of mortality and complications. So everybody needs to try to get their flu shot every year, and that will help protect those around you as well. If you're not infected, you're not going to infect your children either. Flu shot's very safe as well. There are very no side effects from it, and so it's something you should really invest in.
And it's something I could talk about all day. Unfortunately, we are now out of time. And I wanted to mention before we go to break, we are going to have the next segment is with Shannon Nissenbaum. She's a pediatric resident, and it's another hot topic, so don't go away.
Kids will spend 57 minutes making me go splat.
Brushing for 2 minutes now can save your child from severe tooth pain later. 2 minutes, twice a day. They have the time.
Kids will spend 8 minutes decorating their little brother.
Brushing for 2 minutes now can save your child from severe tooth pain later. 2 minutes, twice a day. They have the time.
Welcome back to For Kids' Sake with Dr. Lance Chilton. And one of the great things about this show is we get to talk to experts like you and other experts, but we also get to talk to some of the doctors in the trenches, the residents.
Yes, our pediatric residents do wonderful things. The interview that you'll see in just a moment is of Shauna Nissenbaum, who's one of our pediatric residents. Dr. Nissenbaum is an expert in the screening of newborns for critical congenital heart disease, subject to a law that just passed the legislature this year. So let's go to that segment. We're here at the Young Children's Health Center with Dr. Shauna Nissenbaum, one of our excellent pediatric residents from the University of New Mexico. Dr. Nissenbaum, thanks so much for being here with us.
Thanks so much for having me.
We're here to talk about a new test that has been added to what is done to newborns here in New Mexico. Can you tell me a little bit about that test?
Sure. So the test is to detect critical congenital heart disease, which is heart disease that can be life-threatening and needs interventions such as surgery in the early newborn period. The importance here in New Mexico is occasionally these children can go home from the hospital without any kind of detection of this heart disease. And when they go home and they don't have intervention available at home, they can become very, very sick very quickly. And so now that we have this screening available, we're hoping that we'll be able to catch more of these critical heart defects than we otherwise did before.
Is this a common condition?
It's not very common. About 1% of the population is born with congenital heart disease, and even fewer than that are born with critical congenital heart disease. It's about 1 in 200 births. But the importance lies in how devastating it can potentially be if we don't catch it. It could lead to death if we don't catch it early enough.
Is this something that you've seen in person?
There was a child who was born at the UNM Children's Hospital who was born to a mother who had a pretty normal pregnancy, and in the first 24 hours of life he was doing well, he was feeding appropriately, and there weren't too many concerns for him. Overnight he had his testing done for the screening for the critical congenital heart disease, which we found out that he failed when we arrived first thing in the morning. Upon finding out that he had failed, we brought him into the nursery to do another exam and to look at him again. At that point, he was looking a little bit bluish in his legs, and over the course of about an hour or two, he started having some difficulty breathing, and he was breathing faster than normal and developed a strong murmur. And at this point, we started to become very concerned, so we were able to call the pediatric cardiologist and send him to the neonatal intensive care unit for more support than we were able to provide in the nursery.
And I understand then he went off and had surgery and is living happily ever after.
He did. He was able to fly out to Denver the next day, actually, to have a very, very important surgery that saved his life.
So the test will be done when and on which babies?
So the test should be done after 24 hours of life and prior to leaving the hospital. And it should be done on every child that is born within a hospital that will do these tests. Parents can opt out if they choose to, once they've been instructed as to the importance of the test.
The test is done at 24 hours. Why not just do it right after the baby's been born?
There are certain types of defects in the heart that won't present necessarily that early in life. So some of them are dependent on different types of blood flow that are only affected usually after 24 hours of life, because there's a change in the blood flow from before a baby's born to after a baby's born.
We hate to do things to babies when they're bonding with their parents. Is this a lengthy procedure? Is it painful to the baby?
It's not. It usually only takes about 10 to 15 minutes at the most. Partially, babies have to cooperate. So we like to get it while they're nice and calm, or else it can be a difficult test to determine the accuracy of it. So the test should not take very long in and of itself. It's not an invasive test. We use an adhesive bandage that we wrap around the right arm and one of the legs. And this will help us to determine the oxygenation levels in both locations.
So it's not painful. It's easy to do. Is it expensive?
It's not very expensive. It usually costs between $6 and $9 for the initial test, using the oxygen probe and having one of the nurses come in and perform this test. It can potentially get a little bit more expensive if the baby fails the test and we need an echocardiogram, which is an ultrasound of the heart. It'll allow us to see the structure of the heart and see if there's any actual defects of the heart. But these are usually covered by insurance.
So insurance would cover the initial test and any follow-up tests that needed to be done?
Most insurances should cover it, yes.
Are there any other conditions that would lead to the test being abnormal?
Absolutely. There are lots of different lung diseases that can potentially cause children to have a low level of oxygenation. Sometimes there's a little bit of fluid left in the lung after birth. Sometimes babies have a little bit of difficulty breathing initially after birth. There's also infections like pneumonia, an infection of the lungs, or a really bad infection of the blood that can cause the oxygen levels to be a little bit lower than they should be. There's also severe anemia and structural defects of the windpipe that can all potentially cause low oxygenation levels. So even if we're not catching the critical congenital heart diseases, we frequently will catch something that's going on with the baby that's important that we do some type of intervention for.
The law was passed in the legislature just this February. When does it take effect and how will it be rolled out?
We're hoping that it'll take effect in the next 12 months or so, and it'll be a matter of getting all of the hospitals within New Mexico to start implementing this new test.
All those hospitals that deliver babies anyway, right?
Yes, yes.
And I think there are about 30 of those. That's going to be a big deal.
It will. But if it means that we can potentially catch critical congenital heart disease early, it means that babies' lives might be saved. So we find it important.
We have this law that's coming into effect. Let's hope that it saves some babies.
Absolutely.
Thanks so much for being here.
Thank you.
She was awesome.
She is.
Yeah, that was great. And that's what I love about the show. You've got the experts, you've got the residents, but wait, there's more.
Well, we'll be talking with some parents, a part I enjoy very much.
Awesome.
What to do? Movies! To do or not to do?
Need a little culture? Check out the new online calendar and plan your night out on the town. Find film festivals, club events, and live theater. There's more to do in ABQ. abqtodo.com.
Rosalinda, here's where we get to combine two of my favorite things, talking with people about children and reading. So we're going to go out to one of Albuquerque's wonderful branch libraries and talk with people.
Hi, doctor. My question is, both of my children have eczema, particularly my daughter, and she gets it really bad, behind her knees and in her elbow creases. And so we've been putting on some lotion, but is there anything else I can do to help her with the itching and all of the fun stuff that comes with eczema?
I think the best thing about eczema is that it usually goes away, but it may not go away for some years, so your question's really important. Somebody once wrote an article showing that eczema is as bad for people's quality of life as serious diseases like diabetes and muscular diseases. So we don't take it lightly. We really do treat it and hope that we can make it better, and almost always we can. You're using lotion, which is very important, particularly here in the Southwest where it is so dry. I often tell patients that one thing they could do is move to Hawaii or Florida, but most of them haven't taken me up on that, fortunately. So what else can you do? Lotion is really a good thing. I think not washing too frequently is another important thing. Little kids, like your son who wants you to go somewhere else right at this moment, little kids don't really have much sweating or body odor, so you don't have to wash them every day. You wash the parts that are dirty because actually washing dries out the skin. Putting the lotion on right after he does take a bath, or she takes a bath, is helpful. Now, we often find that steroid creams are necessary. And you can buy a very weak kind of steroid cream over the counter without a prescription. And there isn't really much downside to using a small amount of hydrocortisone on the eczematous areas a couple times a day. Your doctor may think that your children need something stronger than that, but that's usually a good start. And then the other thing is, if you notice things that he eats or she eats that make it worse, that isn't usually the case, but if you do notice that, then you'll want to avoid those things.
Sure. Doctor, I appreciate you answering my question.
Well, thank you for asking it.
Thank you. I can see why you enjoy that. You get out in the community and you're surrounded by books.
Can't be better than that.
Yeah.
So I hope that for those people who can, they'll come to a library for anything, but also to ask me questions. And for those of you who can't, please go to our Facebook page, which you'll see on the screen right now, and ask questions that I hope we can get to in future segments of this show.
Yes, and I hope they will tune in to future segments of this show, because we have lots of really interesting topics, from obesity and some of the other things.
To reading, to diabetes, to allergies, you name it.
Awesome. Well, thank you so much for sharing your expertise with all of us.
Thanks for being here with me.
And thank you to all of you. Hopefully you'll be joining us next time. Bye.